Spending some time with Dr. Helen Torok, who is the medical director here at Trillium Creek, one of 4 locations. We're in beautiful Medina right now.
Beautiful,
And
sunny.
Sunny. It's always sunny and tropical in Medina, right? Where else can we go for
You
Trillium?
can go to Brunswick,
Okay,
Worcester, and Wadsworth.
terrific.
Yeah.
Let's talk today about the effects of COVID, the side effects of COVID that maybe people don't think about. But I understand there are people that went through COVID that suffered hair loss. Tell me about that.
So hair loss can be caused by a number of diseases or events. The most common thing we see from the COVID in hair loss is telogen effluvium. So you have a high fever, you're sick, you may be hospitalized, you may not, but you're sick. A couple weeks, you're not feeling well. So then 2 months later, all of a sudden you're combing your hair and you're going,
That's scary.
10 hairs on a pull, right?
Right.
So the hair kind of goes into a shock state because it's been sick. So it actually goes into a resting state. 80% of your hair is always growing, 80%. 20% is resting. You go through something tragic or horrible, whether it's an accident, COVID, your hair, or any stress, exactly.
Right.
It goes into a resting state. And it reverses. Instead of 80% growing, you may only grow 50%, 40%, and it just sheds.
So what do you do to rejuvenate that? Is it possible?
It's not permanent, thank goodness.
Okay.
It will regrow, but you have to talk to people. I see probably 2 a week now from the COVID because a lot of people have had COVID, right? So we give them special vitamins. We use oral minoxidil.
Okay. Used to be, you applied that directly.
Men have used it for years, decades.
Is that Rogaine?
Rogaine.
Okay.
Rogaine, the chemical name is minoxidil.
Okay.
So we actually give it to them orally for about 3 months to reverse that telogen effluvium.
Right.
We give them a special shampoo, the Growing My Hair, the vitamins, make sure they're on a high protein diet. Carbs don't grow hair, protein does.
Gotcha.
Because hair is protein, as are nails.
Let me ask you this, though. The side effect from COVID that has affected a lot of people, not just hair loss, but rashes.
Oh my goodness.
Because of the masks, for whatever reason.
Well, the mask will give you the acne. It's called maskne, right? Maskne, yes.
Right.
So
Appropriately
in
named.
the area where the mask is, you can start getting all kinds of bumps and pimples and pustules. So you can use an oral antibiotic, you can use preventative creams. But the rashes that we're seeing, not only from COVID, but the vaccinations. Oh my goodness. Within 2, sometimes 3, 4 months, you got an outbreak of psoriasis, which you've never had before.
Is that typically an allergic reaction, or is that just a side effect?
It's a side effect. It's not an allergic reaction. Allergic reactions are hives or swelling.
And those come on fast.
And those come on fast.
Okay.
Yeah.
All right. Well, this is really interesting. So people can come to you if they have these kind of symptoms. But when do they normally come to you anyway to see a dermatologist, doctor?
Fortunately, women are maybe a little smarter than men. I shouldn't say that, should I?
I'll say it here. I will. Yes, definitely.
But they're more proactive.
And they're also more in touch with what they see.
And their families. They have to watch you and your children.
Right.
So they're more proactive. When they get a new spot that's growing or a change in anything or they start itching, they'll come in soon. Wow. Men procrastinate and wait because it's going to go away. It's going to get better.
Right.
And it's the wife that drags them in.
Well, I think it's great advice. Men, if you're watching, listen to whoever's around you, but really, you take a closer look and see a specialist, an expert at that too. Thank you so much. If people want to get more information on your locations, they can just go simply to
TrilliumCreekOhio.com.
It's as simple as that.
Yeah.
Thank you so much for your know-how and your insight. We appreciate it.
Thank you.
All right. Thank you.